Hi guys, welcome back to my channel. So if you've been watching my series with Omron, you'll know I've been talking to Carol Lucarelli. And in this clip, are talking about Vital Sight. Vital Sight is amazing. She's going to explain it all, but to my doctor friends, I need you to jump on board. And patients, I need you to talk to your doctors because this is a game changer. So find out more information about Vital Sight. And of course, you can click links below if you are a physician that wants to begin doing Vital Sight, and if you are a patient that would like your physician to begin Vital Sight, we have the information in the box below. Vital Sight earlier, and I
Yes.
am dying to hear more about that.
Oh, it is Omron's first entrance into remote patient monitoring. So, as an example, I'll use my dad as an example because he just turned 83 or maybe a week ago or so. And I should know that. I hope he doesn't watch. Anyway, if he has uncontrolled hypertension and his healthcare provider has identified, like, we need to track this, like, in real time, that's where Vital Sight or a remote patient monitoring service really hits the mark. It's great if I'm walking around and I'm taking my blood pressure several times a day with HeartGuide. I still have to physically send that to my doctor. With Vital Sight, you can, it's, I'm like so excited. You can actually have your blood pressure readings show up in your electronic medical record at the doctor's office. So a lot of times doctors are looking at your chart while they're talking to you. Vital Sight integrates those readings right away. Now, this is, again, it's if your doctor identifies that you need to take things to this level, right? So Vital Sight will collect your blood pressure readings. We can also include a scale in a kit. So what ends up happening is the doctor orders the kit for you through their system. You get a box at your house that includes a blood pressure monitor and a scale and a toll-free number to call if you're having problems, which is awesome. And the devices are all paired when you receive them. So even if you're tech challenged, like my dad is, these things are all synced or pre-paired when they come to your house. And the cool thing is you don't even have to have Wi-Fi at home because
that's amazing.
That is amazing because we send this little hub, and it's this little thing with an antenna on top. You plug everything in and you are good to go. So what we encourage patients to do is you follow your doctor's instructions, because they ordered this for you, on how many times a day you're supposed to be taking your blood pressure. And magically, through technology and the cloud and stuff, your readings, your weight, if your doctor wants you to weigh yourself regularly, daily or whenever, all that information goes into your EMR. So what I talked about earlier is if you're on medication or you're on, your doctor has asked you to do something and it's not having the expected impact, right? I put you on this medication, it should clear things up. Nope, it's not clearing things up. And that's normal. I mean, there are people who try a variety of different medications to get to that point. Your doctor will see that information practically in real time and can make a change to your medication instead of waiting for you to go back to the doctor's office next month, 3 months from now, 6 months from now. And that's really the benefit of Vital Sight. It's also great for people maybe who have suffered a cardiac event and now they've got to get serious about monitoring their blood pressure. You don't want to take chances, right? You do not want a repeat event. You want your doctor to have the most current and accurate information, and you get that from Omron devices through the Vital Sight program. So it is, really focused on managing challenging cases of hypertension. And it's also great for people who right now maybe are leery of going into their doctor's offices or, don't want to expose themselves to a bigger risk. We heard so much in the news during the pandemic about people who were afraid to go to the hospital to take care of, like I'm experiencing chest pains or I'm having this,
And then
it
they
feels
went
like
too late.
it's too late at that point, so here's a service that your doctor orders for you. The equipment comes to your house, the doctor gets the data, and they can make those decisions, like on the spot with the information they're seeing. We launched it at CES earlier this year, and just the impact that we've been able to have through physicians with their patients, it's been amazing. And I know we're both in the Chicagoland area. Northwestern Medicine has a pilot with this going on, and they're testing it out. Mount Sinai in New York, other hospital systems around the country, other healthcare organizations have all done this. So I would encourage, if your viewers are either physicians or their patients, or you are a caregiver like I am sort of to my dad, I would encourage you, visit omronhealthcare.com. Look at the Vital Site page. Doctors, there's a information there where if you're interested in being able to offer this service to your patients, you can sign up to get more information. Patients, learn about Vital Site. Talk to your doctor. It's a great program. It is it's reimbursed right now through Medicare. So really, for Medicare patients, those of you in those in your viewing audience who might be on Medicare right now, bring knowledge of this to your doctor to see if it's right for you. If you've got high blood pressure, it's important.
Very